My name's Chad Whitaker. I'm 41, and I recently developed heart failure. Um, Basically, I was on like a little vacation, a trip away from town, and I noticed I had swelling in my legs and feet. I had shortness of breath, and I had a persistent cough that I had been ignoring for a few months, just brushing it off as being sick or whatever. Um, so I eventually agreed, with the persistence of my fiance, to go to an urgent care. When I went into the urgent care, they basically took a look at me, heard my symptoms, and said, "We believe you're in heart failure. You need to get to the emergency room as quick as possible." So we headed to the West Shore UPMC hospital, got admitted immediately, had a team of doctors around me looking at my symptoms, checking out my condition. And basically, that first couple hours, it was touch and go. I mean, there was no guarantee I was going to make it through. Um, when it's all said and done, I had about 30 pounds of fluid that came out of me over the course of 17 days where I was in the hospital. So, getting back to the first day, I spent the first 12 hours or so at West Shore. Then I was transferred over to the Harrisburg UPMC hospital because there was more specialist cardiac doctors over there. That was an interesting trip. It was freezing cold. We left at midnight from one hospital, arrived at the other. I was rushed around, um, basically still waiting for answers. A bunch of tests were being ran. Was giving blood every 5 minutes to try to figure out what was going on. Um, but by the next day, I started to become more stable. I wasn't out of the woods yet. That would take several days, but I was comfortable. I had a whole team of doctors surrounding me, giving me updates every few hours. I had a wonderful team of nurses. I was in the ICU cardiac unit for about 7 days of my 16 or 17 days I was in the hospital. Can't mention enough how wonderful I was treated by all staff, from janitorial to food service to nurses to doctors. Um, so I spent a good chunk of Christmas and New Year's in the hospital. Um, a lot of people kind of have a negative connotation of being in a hospital. My experience was wonderful. My fiance laughs because I keep talking about how good the food was. I'm an artist, so one of my ideas was to create a piece of art, a video documentation of my entire process. I'm still working on that. I want to wait until I'm pretty much back to normal to finalize everything. So, even in that aspect, I was kind of energized by the whole experience, what happened to me, to be able to make things and tell my story and try to be a positive influence on people that might be dealing with something similar, whether they're just resistant to go in and get checked out by ignoring their symptoms the way that I did for a few months, or someone going through it with fears about how they're going to come out on the other side, how the treatments are going to work, how the medication is going to work, how they're going to feel. Pretty much the day I got out of the hospital, changed my eating habits completely around. I became much more active. I walk between 3 and 5 miles every day. Going back to the middle of the summer, way before heart failure, way before I knew I had anything wrong, my mother passed away at the UPMC hospital in Altoona. And even back then, like, I remarked on how wonderful the nursing staff were, the doctors, how everyone was in a good mood. Um, I nominated a few nurses for the Daisy Award. And at that point, I felt like something was missing from my life. So the idea of volunteering popped into my head, but I didn't know what aspect. I thought about working, maybe volunteering in a nursing home or something similar. I think the first week that I got home, I submitted an email over to Shonda. We had a conversation on the phone where she went over all the details, explained how things worked, and the one option that she threw out there was actually being, I believe the term's liaison. on one of the floors where you kind of interact with patients. If they need a magazine or a book or something like that, you get it to them. But the main thing was just being there to talk, being there to, you know, provide some company to maybe somebody that doesn't have a lot of visitors. And um, surprisingly, I'm going to hopefully get to volunteer on my floor at the Harrisburg Hospital where I spent the second half of my visit, the cardiac unit, non-intensive care. So the main reason I'm doing this is to give back, to try to make a difference, to try to brighten up someone's day and make a rough experience a little bit better. But it's also a little bit for me to try to keep that feeling of gratitude, of being positive towards life, that feeling that I'm given this chance and it's something that I need to like really um, respect, like the chance at having more years of my life to live and opportunities to do more. I think that volunteering will be a great way to keep that mindset, seeing others going through what I went through, keeping it fresh, and not letting myself become jaded again to how I was before this whole experience.